Appreciate the opportunity to be here to participate in the meeting today. It's been such an interesting day. I just wanted to point out before I get started that these are my personal views, and they don't represent the view of the FDA, the HHS, and the federal government. And really what I'm going to be talking about today, obesity treatment, how to measure success for public health, really draws on my experience for the years that I worked as an epidemiologist at NHANES, and also treating and caring for adult patients with obesity at the Johns Hopkins Healthful Eating Activity and Weight Program. So it's been 10 years now since the AMA has said that obesity is in fact a disease. And this is a really exciting time to be in obesity medicine because there are more and more highly effective treatments that have become available. And of course, as this happens, this debate about what this means for obesity is playing out in the public sphere. And I thought these two set of articles that came out within 2 days of each other are interesting. One from the Hill saying that we cannot treat our way out of the obesity epidemic. And then from the Economist, new drugs could spell an end to the world's obesity epidemic. So treatment has definitely become more and more prominent in our minds. And so I started to think, well, how are we going to track this on a public health level? And so I went back and looked at some other chronic conditions that do have highly effective treatments, and just to see if, just to kind of get a sense of what we do for other conditions. And I'm going to try to move this out of the way if I can. Okay. So for hypertension, we have hypertension diagnosis, hypertension treatment, and then we say blood pressure goal is met, or sometimes we call it controlled hypertension. Okay. Then for hypercholesterolemia, we have diagnosis, treatment, and from looking at the guidelines, maximal ASCVD risk reduction is really the goal. For diabetes, we have diabetes diagnosis, diabetes treatment, and then success is being at glycemic goal. For obesity, we have obesity diagnosis, obesity treatment. And so then the question is, what words do we use to define success? So I went back to the current obesity treatment guidelines from different societies to see what they say. The 2013 AHA ACC TOS recommendations have a treatment algorithm, and it ends with, if you're successful, with weight loss greater than or equal to 5% and sufficient improvement in health targets. And also mention that these health targets or the health goals are to be determined by the patient and the clinician. And I also want to mention that weight loss maintenance is also part of their definition. For the Obesity Medicine Association, their overall management goals for adults, improve patient health, improve quality of life, and improve body weight and composition. And they say that 5 to 10% weight loss may improve both metabolic and fat mass disease. For the Endocrine Society, this was focused on, this is from their pharmacological management of obesity clinical practice guidelines. So this is focused on pharmacological treatment, but it says in order to promote long-term weight maintenance, we suggest the use of approved weight loss medication, and this is in adult patients, to ameliorate comorbidities, amplify adherence to behavioral changes, which may improve physical functioning and allow for greater physical activity. The recent clinical practice guidelines from the American Academy of Pediatrics say a key component of treating obesity is to concurrently monitor and treat the comorbidities. And they also recognize that there are research gaps and that longer-term data are needed to establish sufficient weight loss or cardiovascular improvements influencing health into adulthood. So in my background with public health surveillance, we really look to the clinical guidelines and when we're thinking about what kind of metrics can be used for public health surveillance. And I also want to talk about Healthy People 2030. As their website says, Healthy People 2030 sets data-driven national objectives to improve health and well-being over the next decade. And I find this interesting because the national objectives, they pull from they are based on the on the clinical guidelines, but it also requires a tracking mechanism in order to have this objective. So even if you have a clinical guideline, if you don't have a public health surveillance metric to track it, you can't have an objective. So you have to have the clinical guidelines, and then you would have a public health surveillance metric, so that you can then develop national objectives. And this is important because this is saying that as a country, this is what we think is important to improve the health of the nation going forward. So I wanted to look at a couple of the objectives for hypertension. It's not all of them, but one is to reduce the proportion of adults with high blood pressure, defined as 130 systolic over 130 or diastolic over 180, or taking blood pressure medication. And then increase control of high blood pressure in adults, which is defined among the adults with high blood pressure, defined above. The proportion with the proportion with a blood pressure under 130 over 80. For hypercholesterolemia, I also wanted to mention the overall goal for hypercholesterolemia and hypertension come under heart disease and stroke, where the overall goal is to improve cardiovascular health and reduce deaths from heart disease and stroke. Sorry. Okay. So for hypercholesterolemia, one of the objectives is to reduce cholesterol in adults, and that's defined as the mean total blood cholesterol level in the population of adults. Another one is increased cholesterol treatment in adults, and this is defined among adults for whom a statin is recommended based on ASCVD risk as defined by the ACC and AHA guidelines. For diabetes, the overall goal is to reduce the burden of diabetes and improve quality of life for all people who have or are at risk for diabetes. And then a couple of objectives from there. It's not all of them, but just a couple. Reduce the number of diabetes cases diagnosed yearly. And then another one is reduce the proportion of adults with diabetes who have an A1C value above 9%. And then so for overweight and obesity, the overall goal is to reduce overweight and obesity by helping people eat healthy and get physical activity. And then some of the objectives under this is to reduce the proportion of children and adults with obesity, and then another one for adults. And then there's another one, increase the proportion of healthcare visits by adults with obesity that include counseling on weight loss, nutrition, or physical activity, which is kind of a process measure. And so I'm thinking that at some point, we may have a more outcome focused measure that can be translated for public health. I would argue that the first two, looking at the proportion of kids or adults with obesity, isn't really getting at the point. I mean, we remember the marathon runner who came into the doctor, who had a BMI over 30, and his doctor told him to walk for 10 minutes a day. So even though his BMI was over 30, he would be captured as obese, as having obesity for surveillance, even though for him, he was in a weight reduced state and was healthy and in a good place. So for him, even though his BMI was still above 30, how do we describe that?